Yes, this briefing is being aired live on YouTube. A reminder to maintain audio quality, to please keep your phones on mute until it's time to ask your question. If you're able to do so, please use *6 to mute and unmute your phone. Joining us for today's media briefing are Governor Tony Evers, DHS Secretary-Designee Andrea Palm, and our special guest today is Dr. Emran Andrabi, the President and CEO of Theta Care. And available to answer questions is Dr. Ryan Westergaard, the Chief Medical Officer for the DHS Bureau of Communicable Diseases. We'll begin the briefing today with remarks from Governor Tony Evers.
Good afternoon, folks, and thanks for joining us here today. We are back again today for the second briefing this week because I am concerned about the alarming trends of COVID-19 we're seeing across our state. Just yesterday, we hit a grim milestone with 27 new deaths reported. Kathy and I are thinking about the family members and friends of all those who have lost someone to this virus. This is a grave, stark reminder for all of us in our state that COVID-19 isn't over. Our fight against this virus continues, and we know that now it's going to be harder than ever. As you all know, this spring we issued a safer at home order, and we had our state back on the right track. Unfortunately, Republicans in the legislature sued us over that order, and it was struck down by the Wisconsin Supreme Court. That means the difference this fall is that we're missing an important tool from our toolbox that we had earlier this year to try and stop this virus and keep people safe. And it's why, just as I've done over the last several months, today, Wisconsinites, I need to ask for your help. I know it's frustrating, I know it's exhausting, I know it's hard. You've made sacrifices for months, from your job to your schooling to other basic day-to-day activities. You're missing seeing friends and family. You're missing heading to the neighborhood bar to watch the Packer games. You're missing birthday parties and movie theaters and everything that comes with life as it used to be. I know, Kathy and I miss it too. But at the end of the day, whether we're tired or not, the longer it takes for everyone to take COVID-19 seriously, the longer this virus will linger. Right now, we can't live like we're back to the way things used to be. We can't afford to act like things are business as usual. We have to get back to the basics in fighting this virus. First and foremost, I'm asking you to stay at home. Cancel the play dates and the dinner parties. Tell your friends and family members you'd rather hang out virtually because you care about them and you want to keep them safe. Grab a six-pack to drink at home, grab your food to go, and head out only when it's absolutely necessary. You are safer at home. Second, if you have to leave your house, I'm asking you to wear a mask whenever you are out and about. If you're going to the grocery store, grabbing gas, or picking up a takeout, wear a mask. And remember that masks aren't a substitute for social or physical distancing. Just because you're wearing a mask doesn't mean you don't have to stay 6 feet apart. We need you to do both. The surges we're seeing across the state are not an indication that masks don't work. It underscores what we've said all along, which is that masks only work if everyone wears them. My mask protects me, protects you, and our masks work best when we're wearing them together. Wearing a mask isn't a political statement. It's a sign to strangers you see that you care about them, their families, and your community. That's why today I'm also going to call on our businesses, our retailers, and our industries, the folks who have been important partners in this fight all along. I'm asking for your help too. Public health is a team sport, and we know everybody wants to do the right thing and lead by example. Please do your part to keep our customers, our workers, and their families safe by following our mask order, ensuring everyone can socially distance, and help us get back to the basics of fighting this virus. Earlier this year, we all worked together to flatten the curve. We stayed home. We only went out when it was necessary, and we took care of our neighbors and each other. We face that challenge again today to prevent the spread of COVID-19 and work to flatten the curve so that we can ensure our doctors and our nurses and healthcare workers can continue to do their important work. I know these are difficult times. It's been a difficult year, and we have difficult days ahead. But I have no doubt in the grit and determination of the people of this state and the resilience we share when we work together. Thank you all for the work you're already doing and the work we all have to do together in the days and weeks ahead to keep each other healthy and safe. And now I'll turn it over to Theta Care President and CEO, Dr. Imran Andrabi. Dr. Andrabi, you're up.
Governor, thank you very much for inviting me. I couldn't agree more with everything that you have said. And I'll just bring a perspective from our communities that we serve as an organization. We have seen the same increases that you talk about. 4 weeks ago, I had 13 COVID patients in our hospitals. Today, I have 64. That's a six-fold increase in the number of people admitted. 95% of my beds are full. 250 of my workers today at Theta Care team members did not show up for work. And it is not because they're getting infected while they are at work. It is because after a nurse has spent 12, 14 hours doing what she does, or a physician or another provider, we go out, and if everybody is not masking, you get infected or you get exposed to something in the community, and then they cannot come back to work and take care of people. Why it is important is because it is not only that we have to ensure that we are there to take care of the patients who have COVID within our communities, but we also have to continue to ensure that we are there for all the other things that people receive in the community as well. So we are still having people who could potentially have a heart attack, and we need to be there for them. And people who have strokes, and we need to be there for them. And people who develop a traumatic process, and we need to be there for them. And we need to be there for the women who need to get mammograms, and the kids who need to be immunized. And so if our people and team members are going to get infected and they're not going to be able to do the work that they need to do to serve the people of our community, then it creates a very difficult situation for us. So sometimes it's not just the number of beds that are available, it's also the people that actually serve the people in that bed. The other thing that I would say is the answer to taking care of these people who have developed COVID or are developing COVID is not to have more hospital beds, as the governor said. The way we actually can answer this problem or create a solution is by keeping ourselves more safe, by doing the simple things that may be aggravating at times, that may be difficult at times, the masking, the social distancing, not gathering in large numbers. Now going into the flu season, making sure that we get the flu shot, making sure that you're keeping distance from somebody who may have symptoms, making sure that we are not having sleepovers, for example. All of those things contribute to the number of cases that we are seeing in our communities. And as the governor said, this is really a responsibility that we all have to take very seriously, because if some of us do it and others don't, it doesn't work. We all have to play a part. And my appeal to the people of Wisconsin, the leaders, and each and every individual would be, let's do our part, not only to keep us safe, but to keep our loved ones safe and to keep our communities safe. Handling COVID in ICU beds on ventilators and having the death rate that we had yesterday is not the answer to the problem. And we as Wisconsin and we as healthcare providers don't want to see ourselves on that list of the top 3 states in the country that are having the surge that we are having. So please help. Let's come together. Let's figure this out. And as the governor said, we've done it before and we can do it again. And let's follow the simple steps that we need to follow to make it happen. Thank you. Thank you very much.
Thank you, Jennifer. Thank you, Dr. Andravi. I really appreciate you being here with us today. It is really so very important that we hear from you and from other healthcare providers on the front lines of this pandemic. I'm going to start today with the data because I want to make sure that we're painting a thorough picture for you of the realities we're facing here in Wisconsin. So here's where we stand. As of last week, 72 out of our 72 counties reported a high case activity level. This week, we updated our local data dashboard to provide more information to community decision makers about the status of COVID-19 in their counties. Part of this update included adding a new very high activity level, and as of today, 45 of our counties meet this threshold of the very high activity level, which means that there are more than 350 cases per 100,000 people in that county. 41 of our counties in Wisconsin show a growing trajectory, indicating that cases are on the rise. Wisconsin as a whole is also at a very high activity level and a growing trajectory of cases. There are now 125,161 confirmed cases of COVID-19 here in Wisconsin, which is an increase of 2,887 over yesterday. Our 7-day average of new daily cases is 2,405, which is up from 727 1 month ago. Our total deaths have now reached 1,348. As you know, yesterday we added 27 people, our highest single day to date, to the list of neighbors and friends we've lost, and today we added 21 more. Our hearts go out to the families who have lost loved ones to COVID-19. This is what we're facing here in Wisconsin. COVID-19 is a highly infectious disease, and it is spreading in our state. It is stretching our hospital capacity, and it is overwhelming our public health infrastructure. We must take action. Today, Governor Evers and I signed Emergency Order Number 2 to allow healthcare providers licensed in other states to practice here in Wisconsin. While I'm grateful that we were able to take this step to facilitate additional staffing support for our healthcare systems, I'm saddened that we needed to do it. However, due to the surging hospitalizations and staffing shortages, it is a step that we must take. Yesterday, Governor Evers and I made calls across the state with local government leaders, local health departments, and business leaders, and our calls continue today. We're asking these leaders to take action to help stop the spread in our state by implementing policies in their communities and their workplaces. We'll continue to do all we can at DHS to ensure local leaders have information and tools they need to make well-informed and data-driven decisions, like the updated data dashboards and the new mitigation strategies guidance that we also released yesterday. We commit to providing these tools, and we need local leaders to commit to taking action. And that goes for all of us. Each of us can take action to stop the spread. We can wear a mask and stay home as much as possible. If we have symptoms or have been exposed, we can get tested. And we can be sure to quarantine while waiting for our test results. We can challenge misinformation and make sure to encourage our friends to take precautions like physical distancing seriously. And we can reach out to family members because staying connected, even virtually, is so important right now. Wisconsin is at a critical moment in this pandemic, and we each need to double down and help stop the spread.
And we'll now take your questions. A reminder to maintain audio quality, to keep your phones on mute until it's time to ask your question. And in the interest of time, please only one question per reporter per outlet. And we'll begin today with Jonathan Nizer from NBC 26 in Green Bay. Jonathan?
Yes, thank you for taking the call today. My question is for Dr. Westergaard. Is it still the case that we can take the number of confirmed cases and multiply that by 10 to get an idea of the total number of cases in a community, which would seem to mean there's quite a bit of COVID going around, but also then would we divide the death rate and hospitalization rate by 10?
I'm not sure I understand the second part of your question. I think the general principle remains true that when we test people with symptoms and we experience a high rate of positive tests, that tends to indicate we are not testing as many people as truly have the infection. Another way of saying that is, since many people we know are asymptomatic, when we're turning a high level of positive cases, it does indicate that we are underestimating the true number of cases. I would not say that we have enough data, enough understanding of the issue to say whether we multiply it precisely by 10 or not. But I think that as a general principle, our positive cases that we report are still a tip of the iceberg. How big a tip compared to the remainder of the positive infection is hard to say. But we do feel like our testing strategy doesn't reach every single person.
Thank you, Jonathan. Now to Daphne Chen from the Milwaukee Journal-Sentinel. Daphne?
Hi. Thank you for taking these questions. My question is about how contact tracing is going. I think in June, DHS had said the goal was to get about 1,000 contact tracers throughout the state. So where are you guys at now? And, what percentage of cases are you guys able to trace back to another known case?
Thanks, Daphne. We have in fact reached our that initial goal of 1,000 contact tracers. The last update I had a few days ago was that we were in the 1,200 range. And that is a combination of what local public health departments have hired, as well as what the state has hired. We provided resources to local public health to bulk up their contact tracing staffing assets, and we have been providing essentially the surge capacity for contact tracing. So if a local public health department needs assistance because of the cases that they are seeing in their community, they can give us a call and send us cases, and we will work those cases for them. I think it is true that we need more contact tracers. We brought on an additional about 60 in the last week, and we will be making offers to additional contact tracers in the coming days, because the surge in cases we are seeing now is absolutely maxing out the contact tracing infrastructure that we have, and it is because of how widespread the disease is in Wisconsin. It is becoming more difficult to trace that back to trace it back to its source. Where early on you were looking at clusters of cases, small outbreaks, you could trace back to a source. Considering the community spread that we're seeing, that is becoming more and more difficult, and our contact tracers are becoming more and more maxed out in these very difficult jobs. So we will continue to build up our contact tracing resources, both here at the state level, and I know that local public health and local governments continue to hire as well. So I would encourage anyone who is interested in doing contact tracing work to be in touch, and we are taking applications, as are, I know, many others. So it is a place where we need to continue to build our infrastructure, considering what we're seeing in terms of surging cases. But it also speaks more broadly to the work we need to do, each of us, to make choices to stay home, to wear a mask, to do the physical distancing, to not spend time in large groups, all the things that Dr. Andrabi talked about as ways that we together can double down and stop the spread.
Thank you, Daphne. Now to Danny Maxwell from WKOW-TV in Madison. Danny.
Hi, thank you for taking these questions. This question is for the governor. We are hearing that President Trump may now not be coming to La Crosse. Wanted to see if you heard anything about that, if he plans to come to other areas of Wisconsin, and if Green Bay is still on, and your reaction.
I haven't heard anything, so I won't react positively or negatively, but here's the deal. Both La Crosse and Green Bay are two of the hottest hotspots in the state and in the nation, and it makes no sense to me that President Trump come for his campaign events there. So hopefully your information is accurate about La Crosse. I would say the Green Bay fits that same category for sure, and I know the mayor of both cities have asked the president to come. But the other thing, it would be real easy. I know his rallies are held outside or partially outside in some cases. If he does come, please insist that the people wear a mask, and don't allow them into your rally unless they have a mask and they continue to wear a mask. He can control this, and so if he has decided not to come to La Crosse, I appreciate that. Good, it's important timing, and hopefully he'll reach the same conclusion about Green Bay. But if those stories are not accurate, I encourage him with all the strength I have to make sure that people that are there wear a mask or don't let them in.
Thank you, Danny. Now to Brittany Ehrman from NBC 15 in Madison. Brittany.
Thanks for taking my question. This question is for Governor Evers. So we've seen cases spike on college campuses in Wisconsin, and it's spreading into the community. Do you think universities need to do more to slow the spread in terms of closing dorms and going virtual?
First of all, I have to just make sure everybody knows this. Yes, we have campus spread, but we have community spread at the same time. I talked to Dr. Burks a few days ago, and she said we are one of 2 states that have both of those things happening at the same time. So it's both ways. We have community spread and we have campus spread. We're working with the University of Wisconsin system. They've developed a program or a plan for just about any change, any deviations from what's happening on the campus. So I feel confident in what they're doing. It's bumpy. It sure the heck is bumpy, but at the end of the day, the plan that we have developed collectively, I believe, will keep people safe.
Thank you, Brittany. Now to Sean Kirkby from Wisconsin Health News. Sean.
Hi, thank you for holding this. Was wondering, beyond the emergency order today, are there additional actions that you're looking to take to support hospitals? And then so what are they? Have you requested or are looking to make any, or looking to work with lawmakers on making any Medicaid changes or legislative changes? Thanks.
Well, I can answer part of that question. As people may remember, it's been a long pandemic, but I still remember back when the Republicans immediately took our Safer at Home order, or the extension of our Safer at Home order, to court, and as a result of that decision by the Supreme Court, we lost most, if not all, of our ability to mitigate against this virus. And so we are spending our time making sure that our partners in communities, whether it's business partners, whether it's other partners, all get the word out that we need to have compliance. And I know this is around individual responsibility and individual freedoms and all that. I've heard it for months and months and months. At the end of the day, we don't want people to die. We don't want people to have become positive COVID-19 patients. And the only way we can do that is if we have people taking individual responsibility to wear a mask, not go into places where there's a bunch of people without masks in a small area, do the hand washing, all the things that are pretty simple. We're encouraging others to take that message to all the people of Wisconsin, but I don't anticipate the Republicans rushing in to provide some assistance to us. That just hasn't happened yet. We're in the Supreme Court on this today's mask efforts that we're having. So God bless them. They're doing what they think is right. I think they're wrong, and we need the people of Wisconsin to do what they can, accept that individual responsibility, and keep their neighbors and themselves safe.
To the specific question about flexibilities, Sean, I would say that we continue to have robust conversations with our hospital partners and with the WHA, with the association, about flexibilities that would be helpful to them, and will want to continue to do that. These staffing shortages and the impacts that community spread are having on our healthcare providers, as Dr. Andrabi articulated, are things that absolutely minimize or significantly impact the ability of healthcare providers to take care of not only COVID patients, but of the needs of patients who are suffering from other illnesses. And so it is absolutely something we are working on, and we'll continue to talk with the hospitals about how we can work together and what they might need that we should consider, and we'll just keep pushing through this.
Thank you, Sean. Now to Mitchell Schmidt from the Wisconsin State Journal. Mitchell.
Yeah, thank you very much for the call today. So this is a topic we've kind of talked about a little bit in the past, but several business groups have raised concern over what sounds like plans to release information pertaining to businesses where multiple positive COVID-19 cases have occurred. It sounds like WMC is likely filing even a lawsuit to seek to block this release. I was just wondering if you could talk a little bit about what exactly the plan is in regards to information that will be released, how that's going to be released, and what that will pertain. But then also, if you feel at all that that kind of contradicts with comments last month that the state didn't plan to release this information. Thank you.
And here's what we're trying to do. We're trying to obey the law. We have a Freedom of Information request for information, and we aren't going to be putting these lists of businesses on our website. Basically, those businesses that have been involved with closed investigations, we've been asked information by media to release that information. Our lawyers have looked at that, and it is a legitimate release that we're going to be doing, and I can't tell you which businesses or the numbers or anything like that. All I know is we have an obligation to the public to obey the law in that area, and we will be releasing to the people in the media that have asked for that information in the very near future.
Thank you, Mitchell. Now to Rob Sussman from WTAQ Radio in Green Bay. Rob.
Hi, thanks for taking these questions. My question is for Governor Evers. You mentioned before that the lawsuit back in May that did not go in your favor was a loss of a tool in the toolbox. My question to you is, if that tool were still available, would you again issue a safer at home order closing most businesses in the state? And if, regardless, would you ask businesses right now to voluntarily close in order to stop the spread of coronavirus? Thank you.
I have to just correct you. First of all, I don't believe we closed most of the businesses in the state. In fact, most of the people that are employed in the state were employed during that time because they were viewed as essential workers. That said, if we still had some authority around mitigation, we would likely be looking at that, but not necessarily closing businesses, but maybe mitigating and asking for smaller numbers. But that's not in our toolbox anymore. So we are working with businesses not to tell them to have only 10 instead of 20 or whatever people in their businesses, but we are instead asking them to be good partners in this process and to encourage their employees to be safe and responsible outside of the workday.
Thank you, Rob. Now to Mason Dowling from WAOW-TV in Wausau. Mason.
Yes, thank you for taking this call. Governor Evers, I just wanted to pick your brain really quick on, I know you already mentioned, we just also got confirmation about La Crosse, and Eric Trump is still planning to come today, but the Trump administration, when asked about this earlier, was also saying that similar statements weren't being made to the Biden campaign for any visits. I'm assuming that the request to not hold rallies also holds for him?
I mean, as the president has many times chided the Biden campaign for having such small rallies and all the people wearing masks and standing far enough apart, there's a dramatic difference between the two. Jill Biden was in Madison just this last week, and her event, I wouldn't call it a rally, her event was physically distanced. It didn't have many people there. Everybody was wearing a mask. And so they're two different things. If Joe Biden was coming to town to do a couple of thousand or 500 person rally with nobody wearing a mask and him not wearing a mask, yeah, I tell him to stay home too.
Thank you, Mason. Now to Stephanie Hoff from West Politics. Stephanie.
Hello, and thanks for taking my call. I also have a question about the WMC lawsuit. They are suing you. So my question for you is, they're arguing that the business names released that had COVID-19 outbreaks through the records requests were from medical records, and then that's why that's illegal. So I'm just looking for a response on that.
I haven't seen their lawsuit, so I can't respond to that.
Thank you, Stephanie. Now to Victor Jacobo from CBS 58 in Milwaukee. Victor?
Hello, good afternoon, and thank you again for taking the call. My question is for the governor. I know you said that in the past that the position of Republicans has been that they're not interested in putting in place anything that's similar to Safer at Home. However, I'm wondering if in recent days that with the given surge, you have reached out or communicated with Republican leadership to see if there's any area of compromise or anything that could be done, that you can reach to an agreement given the current surge. Thanks.
Yeah, Victor, that's a great question. I have not. Clearly, they made it very clear. We're in court right now with them. They're trying to take away the most recent mask order. There are plenty of Republicans on the record saying that masks are not, they're against requiring people or asking people to wear masks. So there's nothing new in that world. I'll be glad to work with them if they've changed their mind. I don't think they have. I was on a radio broadcast this morning where the announcer or the radio personality was talking about the Republican legislators in that area have said time and time again that they feel wearing a mask is counterproductive. And so there's, if I thought there was any shred of possibility that they would be interested in doing something, be glad to do it. But by God, they haven't been in session for a long time, and there's nothing for me to believe that that's changed. So be glad to hear if that's changed.
Thank you, Victor. Now to Will Cushman from Wiscontext. Will.
Good afternoon. Thank you. I am wondering why the Department of Health Services updated its calculations for test positivity yesterday, or at least added this new methodology which calculates test positivity by total tests. I'm curious about why exactly the department decided to do that now, and I'm curious because a conservative think tank in the State MacIver Institute seems to think that, or they're taking credit for it, and seem to think that a recent article that they posted that received quite a bit of attention on social media may have been involved in that decision. And I'm wondering if you could confirm or refute that. Thank you.
Sure, Will. I think that article was given a pants on fire by PolitiFact to start with, but we throughout this pandemic have added, updated, expanded the kinds of data we put out there, the way it's visualized, the way it can be downloaded and used by the public and decision makers to really understand what's happening in this pandemic, and that measure was added as part of a broader update yesterday or earlier this week, and we'll continue to make those kinds of additions moving forward. I think that metric, as well as test positivity by person, are important metrics to understand what's going on here in Wisconsin, as are other metrics that are available on the website. And you know, we have said many times that looking at a single metric doesn't give you the full picture, and so feel very strongly that the more ways we can provide information, the more ways we can, the more pieces we can provide to make a picture, to provide a more thorough set of information, that's what we can and should do to help our local leaders and communities and counties and regions understand what's going on and make the best decisions for themselves and for the people in their communities.
Thank you, Will. Now to Monique Lopez from WLUK in Green Bay. Monique?
Hi, this is Ben Krumholz filling in. Thank you for the opportunity today. It's been 1 month since the CDC sent guidance to states to prepare for vaccine distribution as early as October. While the vaccine isn't here yet, what has the state done in that time to prepare, and is it ready for distribution?
So we absolutely have undertaken planning efforts. We have a team of folks that are working on that. I think some of the complexities around planning are not actually knowing what the vaccine is, what sort of storage it requires, therefore how you would transport it, how you would move it around the state. So there are some important details that we need to understand to sort of fill in the gaps in our planning processes. But we absolutely will be ready when vaccine is ready, and are very much looking forward to that.
Thank you, Ben. Now to Eric Richards from WFRV TV in Green Bay. Eric.
And good afternoon, everyone. Thank you so much. My question is, since the COVID-19 numbers are increasing daily, do you think that we will reach a point where everyone should be tested for COVID-19, regardless of if you believe you've been in contact with somebody or have symptoms?
Yeah, do you want to talk about the...
That's a good question, but no, we don't have the capacity to test every Wisconsin resident right now or with any frequency. So we need to do two things. We need to prioritize the testing capacity that we have to where it's needed most, which is people with symptoms and people who have been exposed. The other thing we need to do is reduce the risk of the entire population becoming exposed and becoming infected. So the testing plays an important part of our response because it tells us where the virus is spreading, and then therefore where do we need to specifically focus our efforts on breaking chains of transmission. But right now that's very difficult because of the very high number of cases that we're seeing. So we need full public cooperation in flattening the curve right now so that we can use those positive test results to understand where the virus is spreading and then stop those chains of transmission. It would be very nice to live in a world where we had 6 million tests available to be used on a regular basis, but we don't have that. So, and it still would actually not be sufficient to test everyone unless we really did these other things of isolation and quarantine very aggressively. So right now we have a very large amount of test capacity to use it in that very focused way. But in order to use that capacity wisely and not outstrip that capacity, we need to have a statewide approach to reduce transmission. And those are the things that we're talking about with the mitigation and the widespread social distancing and mask use.
Thank you, Eric.
Thank you, sir.
Now to Adam Rogan from the Journal-Times in Racine. Adam?
My question has been answered. Thank you very much, guys.
Okay, thank you. Now to Cassandra Gauthier from CBS News. Cassandra? Okay, moving on then to Jorge Rodas from Spectrum News. Jorge? Again, Jorge Rodas from Spectrum. Okay, moving on then to Kent Wayne Scott from WISN TV in Milwaukee. Kent.
Hi, thank you for doing this. Just to follow up on the concerns that the governor and others have about large campaign rallies this weekend. It's been 2 weeks since the president held a similar rally in Mosinee. Has contact tracing shown any cases or indicated any COVID impact from that event?
Not that I'm aware of, but we have, many dozens of outbreaks and thousands of cases that we're investigating on a regular basis. So we can look into that and get back to you separately. But I'm not aware of specific clusters identified in that region.
Thank you, Kent. Now to Eric Gunn from Wisconsin Examiner. Eric?
Thank you for taking my inquiry. Could you flesh out a little bit for us the conversations that you've had with local leaders that you've mentioned today and yesterday? What kinds of specific things are you asking them to do in their communities, and what kind of response you're getting from them?
Well, we talked to local elected officials and city and county officials, but we also talked to many business leaders across the state. And the ask was pretty much the same for both. But with the business leaders, we thank them for their good work, and along with the guidance from WEDC, Wisconsin Economic Development Corporation, to keep their own workers safe. That is important. We also thank them for whatever they've been doing to be able to keep their customers safe while they're in their businesses or visiting their businesses. The ask for them was quite simple. They're leaders in their communities, whether it's in an urban area or a rural area, and whatever they can do to help their employees understand how important it is for them when they're not at work to stay safe and healthy and wear masks and do all the things that are important to stay healthy in this day and age of COVID-19, and to encourage them to do that and help them understand that by doing that, they help that business stay economically strong, and they help their communities stay economically strong. Our discussion with the leaders and elected leaders and other government officials in different parts of the state were pretty much the same, encouraging their own employees to make sure that they're safe, and to examine whether there are opportunities for them to take a leadership role in mitigation above and beyond what they're doing now. It's a good conversation, but at the end of the day, we all know it comes down to individuals believing that this virus is serious, and it is serious. And we, whether you wish to buy into that thinking, I can tell you that weekly we get an analysis of our success in the state from the White House, from the President Donald Trump. And this last week, they talked specifically about the rapid worsening of the state of Wisconsin's increase in cases. They talked about an intense virus spread. They talked about the spread being exponential. They talked about the fact that there's a dramatic increase in cases that are not related to campuses, and that we have statewide spread. And I'm just hopeful that our conversations around the importance of this will bear fruit, and that the leaders at the local level and the regional level can help not only their employees, but the people living in their parts of the state, that this is serious stuff.
Thank you, Eric. Now to Steve Prestegard from the Plover Journal. Steve.
Thanks for taking my question. And this is sort of a follow-up to, I think, two questions that were previously asked. You've said repeatedly, Governor, that there are things that you now are not allowed to do because the safer at home order was invalidated by the state Supreme Court. However, since then, the makeup of the Supreme Court is not the same. And so for that reason, I'm wondering if you were considering actually reinstituting or instituting a new statewide shutdown order similar to safer at home, because of the possibility you might get a different result at the Supreme Court.
Yeah, we analyzed that thoroughly, and it was clear that in that decision, the majority switched around from place to place. The majority around mitigation issues and compelling the business sector to do certain things, that was created by a larger majority than the one that we can overcome. So we looked at that. Clearly, our ability has been limited in a significant way. We did the mask order based on what we saw, what the vote was that time, and the fact that the Supreme Court has changed. That's back in the Supreme Court, so we'll see if we made a correct analysis of that. But we feel that our ability was severely impacted by the original decision.
Thank you, Steve. Now to Lindsay Christians from the Capital Times. Lindsay. Once again, Lindsay Christians from the Cap Times. We'll move on then to Mary Spacuzza from USA Today Network, Wisconsin. Mary?
Hi, thanks for taking my questions. Wanted to just check to make sure I'm reading the data correctly. I just did a quick glance while we were on this call. It looks like the state is reporting a record number of cases and hospitalizations today. So could you just correct that for me if I'm wrong, or confirm that? And then also, given that situation, did Governor Evers write a letter to President Trump and encourage him to cancel these rallies, or could he take action to do that?
I'll answer the second part of that question. No, I didn't write him a letter. I know they follow the media extensively, so there's no question that if he wanted to know my opinion, he sure could have had it. So no, I didn't write a letter, and there is nothing that we could do to prevent it ourselves.
As to the records question, yes, we've had a number of days here with record hospitalizations, and I'm just looking at my numbers, and it does look to me like 2887 is a record. The closest it looks like was September 26, 2817.
All right, thank you, Mary. Now to Madeline Fox from Wisconsin Public Radio. Madeline?
Hi, thank you. The governor had said earlier this week that you did not intend to close schools again like you did in March, but is there a point, especially as we're seeing some reports of families sending their kids to school even after testing positive, is there a point at which you would reconsider that stance or would look at closing a region or the whole state schools again?
Yeah, and I certainly wouldn't do it because people are sending their kids to school with COVID-19, knowing that that wouldn't be a reason I would close schools. That'd be a reason I'd criticize the parent for doing that. But nothing has changed in my thinking as it relates to the ability of schools in a different way to mitigate all across the state. There are reasons that it works well in some school districts, and mitigation is a difficult situation in other school districts. So to any kind of blanket, either region or statewide, I just don't see that happening. We've, we always said it was going to be bumpy, and it is, but at the end of the day, districts, if they are feeling that the spread is too much, they're working with their local districts or local healthcare professionals to make that decision, and several have gone to remote learning. Almost all school districts in the state have had remote learning right from the get-go, and parents are taking advantage of that. So I have no plans to do anything on a statewide basis at this time. The numbers that we see in the schools are small numbers as compared to the rest of the state. If everything works well in the school, they will immediately send the child home, and making sure that the people that the child has in contacted with are quarantined. And I think the good work is going on in the schools, but schools, districts' ability to mitigate is so different across the state. I hesitate to close schools.
Thank you, Madeline. Now to Mayan Silver from Milwaukee Public Radio. Mayan?
Hi, thank you so much. Can you hear me? Okay, great. Wisconsin is a key swing state in the presidential race, and it's now, as we've been talking about, a COVID hotspot. So I'd like to know what the state, in addition to the Election Commission, is doing to ensure that people have confidence in voting by mail and that there's not chaos or COVID spread on election days. So just for some context, voting by mail, confidence in that has taken a dive because of President Trump's messaging and reports of cuts to the Postal Service. And an NPR Marist poll recently found that just 35% of Americans plan to vote by mail and half plan to vote on election day. So this could become a real problem, and I'm wondering what Wisconsin is doing about it.
Well, I feel confident in voting by mail. I've done it. It's already done. And I know other municipalities across the state are doing a great job. It frustrates me to no end to have the president essentially creating a false scenario that fraud is rampant. That's an absolute crap statement from him, and it is an insult to the clerks all across the state. You think about all the hard work those folks do to do the right thing, and they do the right thing. We had 1.2 million absentee ballots last time. We expect to have more. We will have everything is in order. I mean, honest to goodness, I can't stop the president from doing what he's doing, but in the state of Wisconsin, absentee balloting works, and it will continue to work. In addition, subsequent and prior to, frankly, the last April's primary, polling places all across the state got all the masks, got all the plexiglass in place. It is a safe place to vote. I have no problems with the ability of us to have a robust discussion about which candidate should win, and we're going to have a great election here in Wisconsin. It may take longer to count the votes because there's lots of absentee ballots, but I'm not even sure that will be a hindrance here in Wisconsin. Wisconsin is going to have a great election, a safe election, and one without fraud.
Thank you, Mayan. Now to Beauregard Nalen from PBS Wisconsin. Beauregard. Okay, moving on then to Dakota Sherrick from WBAY TV in Green Bay. Dakota.
Hi, thank you for taking these questions. I would actually like to ask Dr. Andrabi a question, if possible. In regards to the planned rallies by the president, how concerning do you find large gatherings like that, even if they're outside and everybody attending wears a mask? How much risk, in your professional opinion, does that still hold?
Dr. Andrabi isn't available, but perhaps Dr. Westergaard?
Sure, I'd be happy to take a crack at it. I think the scientific evidence that says all three of these strategies, wearing face coverings, standing at least 6 feet apart, and meeting outside compared to inside, are effective ways to slow the spread. But neither of them, or none of them in isolation or probably together, are 100%. So I believe that if we wanted to have the maximum impact of reducing transmission, we should use those three strategies anytime we're meeting, but the best response is to not have gatherings at all. Right now, particularly as we've discussed, that transmission is so widespread, overall the level of community spread is higher than it's ever been. Because these strategies aren't 100% effective, it's in all of our interest to stay home as much as possible and to make the number of people that we have close contact with as small as possible. So I think that the conclusion from that is that we should avoid gatherings as much as we possibly can.
Thank you, Dakota. Now to Hannah Jewell from Fox 6 in Milwaukee. Hannah.
Hi, thank you for taking my question. My question is for the governor. We were wondering if you could speak to a spike in cases we've recently seen at the Kettle Moraine Correctional Institution. We're hearing almost half the inmates there have COVID-19. And also, how are we doing with supplies and plans for all state prisons as the spike continues?
Yeah. I can't address the Kettle Moraine issue in any specificity. I know they've had several inmates test positive. Our ability in the Department of Corrections has really been working well. We have had outbreaks and we immediately get people quarantined and isolated so that they don't impact the rest of the group that are under our care in the institutions. And so that I can tell you, and I can also tell you that I believe the National Guard within the last week or so, we've totaled they've had over 40,000 tests done in our correctional institutions just by the National Guard. So testing is a high priority. We test every person under our care, and we'll continue to do that. There will be some outbreaks, and then we want to keep them to a minimum.
Thank you, Hannah. And our final question this afternoon belongs to Todd Richmond of the Associated Press. Todd?
Hi, can you hear me? Hello? I was just wondering. Hi, Secretary Paulman mentioned earlier this week that the state is close to opening the field hospital at the state fairgrounds. How close are we at this point, and what would that look like when it opens up? How many beds are we talking, and who are you going to get to staff it?
Yeah, so we were working very closely with the hospital systems to understand when and if we would need to stand that alternate care facility up. And we'll continue to have those conversations and we'll open it if hospitals indicate to us that they need that overflow capacity. We have a registry of staff that we compiled earlier in the epidemic, which we are currently updating, recognizing that some of the folks who were willing or were able to serve as providers, as workers at the alternate care facility may not be in the same situation, and so we want to make sure we understand what sort of staffing we have and whether we would need to bring under contract a staffing agency or other strategies to make sure we have staff available to provide care in an alternate care facility. But we are working very closely with our hospitals and will continue to make preparations should we need to give it the green light to get it stood back up and ready to take patients.
Thank you, Todd. And that concludes today's briefing. Please continue to monitor the DHS COVID-19 web pages for data and guidance Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.